Top 3 Essential Vitamins. Every diabetic should know about. Lower blood sugar. Health Aura. Know it right, live it light. Have you ever wondered why, even when you're carefully managing your diabetes, you still feel tired? Or why those stubborn blood sugar spikes keep sneaking up on you? Or maybe that tingling in your hands and feet just won't go away, no matter how well you watch your diet. It's frustrating, isn't it? But here's something most people don't realize. Sometimes, it's not just about the carbs or the meds. The real missing link could be certain key vitamins your body desperately needs to stay balanced. In this video, we're diving into the 3 most essential vitamins that can make a real difference for anyone managing diabetes. Vitamins that support not only your blood sugar, but also your nerve health and energy levels. And we'll keep it clear, science-backed and super practical. Ready to discover what your body might be missing? Let's get into it. 1. Methylcobalamin, the tiny vitamin that could transform your diabetes management. Have you ever wondered why, even though you're doing everything right, watching your carbs, staying active, taking your medications, certain frustrating symptoms just won't go away? Maybe it's the fatigue that feels deeper than usual, the persistent tingling in your feet, the moments when your mind feels foggy, unfocused, or unsteady. What if the real culprit isn't your blood sugar, but a simple, silent vitamin deficiency? Enter methylcobalamin, the active form of vitamin B12, a nutrient so small in required dose, yet so critical to your body's well-being. In people with diabetes, B12 deficiency can creep in unnoticed and mimic other issues, making it dangerously easy to miss. One of the earliest signs is worsening nerve pain or numbness in the hands and feet, often dismissed as diabetic neuropathy. But when B12 runs low, nerve symptoms intensify and don't respond to blood sugar management alone. You may also notice balance problems, especially in the dark or with your eyes closed due to damage in spinal nerves. Mental symptoms can appear too: brain fog, forgetfulness, or an unexplainable sense of depression or disconnection. And there are more specific signs as well, such as a swollen, burning tongue or a strange burning sensation in the mouth. But why is this deficiency so common in diabetics? One major reason is metformin, the first-line diabetes medication. Up to 30% of people on metformin for over 4 years develop B12 deficiency, and even lower doses impair absorption. Aging further raises the risk. After age 60, about 15 to 20% of adults are deficient, with or without diabetes. Dietary patterns also matter. Strict vegetarians and vegans are particularly vulnerable since B12 is found almost exclusively in animal products. On top of that, stomach conditions like atrophic gastritis or acid-reducing medications impair absorption, and autoimmune conditions like pernicious anemia can completely block it. To make matters trickier, the liver stores several years' worth of B12, so symptoms often take 3 to 5 years to surface, making this a silent but devastating issue. The damage is far-reaching. Low B12 disrupts myelin, the protective sheath around nerves, worsening pain, tingling, and balance problems. It also causes macrocytic anemia, where oversized red blood cells fail to carry oxygen properly, leading to profound fatigue. In the brain, B12 deficiency disturbs neurotransmitter balance and shrinks brain volume. One study found a 6-fold increase in brain atrophy in those with chronically low levels. The heart isn't spared either. Elevated homocysteine, common in B12 deficiency, damages blood vessels and raises cardiovascular risk. Even the gut can suffer, with impaired nutrient absorption and appetite loss. All this from a vitamin you need only in micrograms. The good news? Reversing B12 deficiency is usually simple, and the benefits can appear fast. Oral supplements of 1,000 to 2,000 micrograms daily work for most people. If deficiency is severe or symptoms are significant, B12 injections, administered weekly at first, then monthly, bypass gut absorption entirely and often yield noticeable improvements within weeks. If you're on metformin, adding about 1 in 200 milliliters of calcium daily can even help improve B12 absorption. While food alone usually isn't enough to correct a severe deficiency, adding rich sources to your diet provides support. Beef liver offers 70-80 micrograms per serving, clams an impressive 84 micrograms, sardines about 7 to 9 micrograms, salmon nearly 5 micrograms, and fortified nutritional yeast 8 to 12 micrograms per 2 tablespoons. A great option for vegans. The best part? B12 is incredibly safe, with no upper limit. Any excess is naturally excreted. And given how widespread this deficiency is, especially in diabetics, this knowledge needs to be shared. This content is essential to be universal in the nursing home and the clinic, where so many patients silently suffer from fatigue, nerve damage, cognitive decline, and cardiovascular risks that could be dramatically improved with this simple intervention. By recognizing the signs, taking proactive steps, and restoring healthy B12 levels, diabetics can unlock a new level of energy, clarity, and nerve health that truly transforms their quality of life. 2. Folic acid, the overlooked key to protecting your brain, heart, and nerves in diabetes. Have you ever felt a heavy cloud of fatigue settling over you? One that no amount of rest seems to lift? Or noticed your thinking becoming foggy, your memory a little slower, your mood dipping in ways you can't quite explain? If you're living with diabetes, it's easy to chalk these changes up to blood sugar fluctuations or simply getting older. But what if there's another silent factor at play? One that rarely gets the attention it deserves. Let's talk about folic acid, the synthetic form of folate, vitamin B9, and why its role in your body is far more critical than you might think, especially if you have diabetes. At first glance, folic acid seems simple. It's added to cereals and breads, and many people know they can get natural folate from leafy greens like spinach and kale. But here's the hidden truth. Your body can't use folic acid as is. It must convert it into its active form, L-methylfolate, to perform its life-sustaining functions. And that's where things get tricky, particularly for diabetics. If you happen to carry a genetic variant known as MTHFR, which affects up to 10 to 15% of the population, your body struggles to make this conversion efficiently. The result? Even if you're taking folic acid supplements or eating plenty of folate-rich foods, you could still be facing a functional deficiency, one that quietly undermines your health. How does this hidden deficiency show up? The first signs are often subtle but deeply frustrating. You might experience a relentless, all-day fatigue, not just post-meal tiredness, but an ongoing lack of energy that makes it hard to concentrate or stay mentally sharp. You may feel increasingly disconnected, a creeping sense of brain fog or forgetfulness that interferes with managing your diabetes. Mood changes are common too. Low folic acid impairs the production of key neurotransmitters like serotonin and dopamine, which can leave you feeling anxious, down, or mentally flat. But for those already dealing with diabetic neuropathy, Folic acid deficiency can be especially devastating. If you've been struggling with nerve pain, tingling, or numbness in your hands and feet, low folic acid acts like a magnifying glass, amplifying the discomfort and slowing nerve repair. What's even more concerning is folic acid's strange relationship with vitamin B12. Excess folic acid can mask the symptoms of B12 deficiency, potentially allowing irreversible nerve damage to progress undetected. In diabetics, where both deficiencies are common, this interaction can silently worsen outcomes unless carefully monitored. Why are diabetics at greater risk for folic acid deficiency? Several reasons. First, metformin, the cornerstone drug for type 2 diabetes, has been shown to lower folate levels by 15 to 20%, especially with long-term use. Second, insulin resistance, a hallmark of diabetes, makes the role of folic acid even more vital because it is needed to break down homocysteine, a harmful substance that damages blood vessels and raises the risk of heart disease and stroke. Alarmingly, 40 to 50% of diabetics with low folic acid also have high homocysteine levels, dramatically increasing cardiovascular risk. And then there's aging. After age 50, your body's ability to absorb and convert folic acid drops by 10 to 15%, even if your diet is excellent. Among people over 70, up to 25% have low folate levels, whether or not they have diabetes. Combine this with the MTHFR gene mutation, and it becomes clear. The older you get, the harder it becomes for your body to use folic acid effectively. And if you have diabetes, the risk compounds further. When folic acid runs low, the consequences ripple through multiple systems. In the brain, reduced folate disrupts neurotransmitter balance, increasing the risk of depression, anxiety, and cognitive decline. In fact, studies show that people with low folate levels are 2 to 3 times more likely to develop mood disorders or cognitive impairment. On the cellular level, folic acid is essential for DNA synthesis and cell division. Without it, you develop megaloblastic anemia, where oversized red blood cells fail to deliver oxygen efficiently, leading to exhaustion and weakness, even when your blood sugar is under good control. Thankfully, folic acid deficiency is relatively easy to correct once identified. A variety of foods can help. Fortified cereals are an excellent source, offering 100 to 400 micrograms per cup. Leafy greens like spinach provide about 260 micrograms per cooked cup, and lentils deliver a robust 350 micrograms per cup, along with fiber and protein that help stabilize blood sugar. Citrus fruits like oranges add another natural source, with about 40 to 50 micrograms per fruit, while nutritional yeast offers a vegan-friendly boost of 8 to 12 micrograms per 2 tablespoons. However, for many, especially those with MTHFR mutations or significant deficiencies, supplementation is necessary. Standard folic acid supplements typically provide 400 to 800 micrograms daily, which is safe for most people. But if you struggle with conversion, L-methylfolate is a superior option, bypassing the genetic bottleneck and delivering the active form directly. In more severe cases, doses up to 1,000 micrograms daily may be needed, though this should always be done under a doctor's supervision. One of the most important effects of folic acid correction is on homocysteine. Studies show that boosting folic acid can lower homocysteine levels by 20 to 30%, providing significant protection for the heart. A critical win for diabetics, who already face elevated cardiovascular risk. And because folic acid also supports nerve regeneration, it can help mitigate existing neuropathy symptoms and prevent further damage. It's also reassuring to know that folic acid is water-soluble and not stored in the body, so excess amounts are excreted in urine. Still, chronic high doses over 1,000 micrograms may cause complications, particularly in those with kidney disease. So monitoring with regular blood tests is essential. These tests help ensure you're getting the right amount and actually benefiting from your supplementation. Ultimately, managing folic acid isn't just about boosting energy or improving mood. It's about safeguarding your nerve health, cardiovascular health, and cognitive function over the long term. And given how often this deficiency is missed, especially in older adults on multiple medications, this content is essential to be universal in the nursing home and the clinic, where proactive management could dramatically improve quality of life for countless individuals. So, whether through diet, smarter supplementation, or a combination of both, addressing folic acid deficiency offers one of the simplest, most impactful steps you can take to strengthen your resilience against the many complications of diabetes. And the difference, when you feel it, can be truly life-changing. 3. P5P, the powerful vitamin B6, form that reawakens blood sugar, balance, nerves, and mood. Have you ever sensed that despite your best efforts, meticulously monitoring your diet, taking your medications, staying active, your blood sugar still feels unpredictable? Or that strange nerve sensations, tingling, numbness, burning, keep creeping in no matter how well you manage your diabetes? Maybe your mood has become more fragile lately, with irritability or worry sneaking into your days. What if one often overlooked nutrient was playing a hidden role in all of this? The answer may lie in P5P, the active form of vitamin B6, a vitamin that is quietly essential to restoring balance across your entire system. Unlike pyridoxine, the standard form of vitamin B6 found in many supplements, P5P, pyridoxal 5-phosphate, is the form your body actually uses. Pyridoxine must be converted in the liver into P5P before it becomes biologically active. But for many people, this process is sluggish or impaired. In fact, up to 30% of individuals with liver dysfunction or genetic variants like MTHFR mutations cannot efficiently perform this conversion. For them, and especially for diabetics, direct P5P supplementation is far more effective and offers dramatically better absorption. P5P is estimated to be 5 times more bioavailable than the inactive forms of vitamin B6. For people with diabetes, the role of P5P is nothing short of critical. One of its most powerful effects is on blood sugar regulation. P5P is deeply involved in the process of glycogen breakdown, helping your body convert stored glycogen in the liver and muscles into usable glucose. Without adequate P5P, this process slows, leading to blood sugar imbalances, with spikes and dips that become harder to control. On a deeper level, P5P also enhances insulin secretion and insulin receptor function, helping to improve insulin sensitivity, one of the most important factors for managing type 2 diabetes. It's no surprise, then, that 50 to 70% of diabetics show signs of vitamin B6 deficiency. This is especially true for those on long-term metformin therapy, which impairs B6 absorption and lowers circulating P5P levels. Without enough P5P, blood sugar control becomes more erratic, and the risk of complications rises. But the story doesn't stop there. P5P is also a guardian of nerve health, a vital concern as peripheral neuropathy affects up to 50% of people with diabetes. P5P supports nerve repair and maintains the myelin sheath, the protective coating around nerves that ensures fast, accurate signal transmission. When P5P levels drop, nerve damage accelerates, and symptoms such as tingling, numbness, and burning pain worsen. In fact, clinical trials have shown that diabetics with neuropathy who supplemented with 100 milliliters of P5P daily experienced significant improvements in nerve pain and function. At a molecular level, P5P also fuels amino acid metabolism, which underpins protein synthesis and the production of key neurotransmitters like serotonin, dopamine, and GABA. Without sufficient P5P, people with diabetes often experience depression, anxiety, or irritability, mental health effects that can severely impact quality of life. Numerous studies link vitamin B6 deficiency with increased rates of mood disorders, and restoring P5P levels has been shown to improve mental well-being. Another often overlooked benefit of P5P is its ability to reduce homocysteine, an amino acid that, when elevated, damages blood vessels and raises the risk of heart disease and stroke. Sadly, 50% of diabetics show elevated homocysteine levels. P5P helps by converting homocysteine into methionine, a safer amino acid, thus protecting cardiovascular health. Clinical studies demonstrate that supplementing with P5P can significantly lower homocysteine, adding another protective layer for diabetics who already face heightened heart risks. While certain foods do provide vitamin B6, it's important to note that the body still needs to convert it into P5P, a process that is inefficient for many. Still, foods such as tuna, salmon, chickpeas, potatoes, and bananas offer a natural source of B6. For example, a 3-ounce serving of tuna provides about 1 milliliters of B6, roughly 50% of your daily requirement. But for those with diabetes, or anyone experiencing neuropathy or mood issues, P5P supplementation is often necessary to truly restore optimal levels. Typical P5P doses range from 25 to 100 milligrams per day, depending on individual needs and the severity of the deficiency. In cases of significant nerve damage, doses of up to 200 milliliters may be recommended under medical supervision. P5P is generally very safe. There is no officially established upper limit, although extremely high doses above 500 milliliters daily could, in rare cases, cause nerve toxicity, hence the importance of guided dosing. For diabetics, the benefits of P5P are profound. More stable blood sugar, better nerve function, enhanced mood, and reduced cardiovascular risk. This is why awareness of this vitamin must spread beyond niche circles. This content is essential to be universal in the nursing home and the clinic, where so many individuals silently suffer from complications that could be eased or even reversed with the right nutritional support. In the end, P5P is far more than just another supplement. It's a powerful ally, one that can help diabetics regain balance, restore nerve integrity, and lift the fog that so often clouds both body and mind. If you're on metformin or struggling with any of these symptoms, talk to your healthcare provider about adding P5P to your regimen. It could be the missing piece your body has been waiting for. 4. Your next step toward better health. If today's video gave you new insights or a fresh perspective on managing diabetes, why not take a moment to like this video? It helps us reach even more people who could truly benefit from this information. And if you know a friend or family member who's navigating the challenges of diabetes, do them a favor and share this video. Sometimes the smallest tip can make the biggest difference. For more clear, practical health advice delivered in a way that's easy to understand and apply, be sure to subscribe to our channel and turn on the notification bell so you never miss an update. Thank you so much for watching. Remember, every smart choice you make today can lead to a healthier tomorrow. Now, go ahead, like, share, and subscribe. And let's keep spreading the knowledge that empowers better lives.